Hi, I'm Dr. Anna Cartwright. I'm a clinical psychologist and PhD research fellow at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. My research focuses on understanding and managing fear of cancer recurrence amongst primary breast cancer survivors. Prior to this, I was working in the NHS as a clinical psychologist in cancer care, providing psychological therapy to people who've recently had cancer and offering psychological skills training and supervision to other cancer care professionals. It was great to work alongside Life After Cancer to facilitate a workshop all about managing fear of cancer recurrence, and I'm here to provide a brief summary of what was covered in the session. We started by discussing how it's understandable that cancer diagnosis and treatment often brings lots of feelings of uncertainty, and how common it is to worry about cancer coming back. Those attending the workshop shared what helps them to manage fears about recurrence. And this included living in the present moment, setting goals for after cancer treatment has ended, focusing on the things that you can control, talking to others, focusing on the known facts, using a strategy called worry time, and focusing on eating well and exercising. We then moved on to think a bit more about focusing on the things that you can control. For example, the importance of having some information about cancer recurrence and using reliable sources to get this information. Being aware of the signs and symptoms of cancer recurrence and how to check your body for those, and also how often to check, so what the medical guidance is around that. We spoke about knowing who to contact and when, if you're concerned about a particular symptom. And also the importance of being aware of and following health and wellbeing guidance to look after our health in general. With all of these strategies, in terms of focusing on what you can control, we really reflected on the importance of balance and flexibility. We then used the Cognitive Behavioural Model to reflect on the links between our thoughts, our feelings, our physical body sensations, and our behaviours. And together we covered a range of different strategies that can help break vicious cycles that over time might keep fears of cancer recurrence going. For example, we talked about having a plan to manage triggers. For example, using a diary to note down any new physical symptoms that you notice and knowing when to seek advice about those. Also, the strategy worry time and how this can be used to take control over when we think about cancer recurrence and manage some of those worries. We reflected on being aware of helpful and unhelpful responses, behavioural responses to fears of recurrence, and choosing how we want to respond to concerns. Then we moved on to some of the cognitive strategies, so the thinking strategies. For example, challenging unhelpful thoughts and practicing detached mindfulness. Finally, we then went a little bit more into detail of some of the physical relaxation exercise strategies that we might use, such as breathing exercises and how these can help to calm our body's anxiety response. Finally, we covered some different sources of information and support that are out there, different charities, NHS services, podcasts, written information. There's something for everybody. And a little bit towards the end of the session, we also thought about a key take-home message. And I shared how I feel as though support is one of the main things that's important, whether that's support to yourself, so being kind and compassionate to yourself and validating that fear of cancer recurrence is an understandable response to cancer, whether that support involves reaching out to friends and family or others within the cancer community, or whether that support involves seeking professional support to help manage fears of cancer recurrence, whether that's seeking support from medical professionals or psychological professionals in order to access evidence-based psychological treatments specifically for fear of recurrence. I think it's really important that people know, that you're not alone after cancer treatment has ended. And just finally, before I finish, I just want to say if you're interested in being involved in any of our research on fear of cancer recurrence amongst breast cancer survivors, then you can contact me via email or follow my Instagram account where I share different ways that people can get involved in the studies that we run. Thank you to everyone who came. It was lovely to meet you, and it's great to hear that you found it helpful in the feedback.